Welcome to the Canadian Thoroughbred Horse Society's standard operating procedures for nasally implanting microchips in equines. In this video, we will demonstrate the process using best practices to guide you through this procedure. What you'll need: halter and lead rope, a second handler or assistant, International Organization for Standardization (ISO) microchips. Note: microchips are single-use only. ISO microchip reader, paperwork or management software to keep records of the equines and the microchip number to be associated with each horse. Who should be microchipping? The nasal implant location can be quite easy to perform once a person has been trained. We believe that anyone comfortable with giving intravenous injections and with average to above average equine handling skills will be able to easily microchip equines. Very few equines require chemical sedation, less than 0.001%, but it's important that your assistant or second handler is comfortable with some form of physical restraint if required. The occasional equine requires a shoulder or ear twitch in order to have the microchip safely and accurately implanted. When should an equine be microchipped? This microchipping location is suitable for all ages of horses, including newborn foals. How to nasally implant a microchip in an equine. 1. Scan the nose and both sides of the neck of the equine you are planning to chip. Equines may already have a microchip in their nose or neck. Never assume that an equine does not have a microchip. If a horse does have a microchip, make note of its location and number. 2. Take one microchip still in the package and scan it with the reader to ensure that it is functional. 3. Write the name of the equine on the back of the microchip package and open the package, removing the syringe with the microchip in it. 4. Place your non-dominant hand on the equine's upper lip and fold the upper lip over the top of your fingers and place the thumb of this hand on the inside edge of the upper lip. 5. Assess the temperament of the equine you are about to microchip. If the equine is objecting, wait until it has stopped moving and release the lip. Repeat the process until the equine accepts the handling or determine if a physical restraint may be warranted. 6. When the equine is ready to implant, place the syringe in your dominant hand with the syringe in between your index and middle fingers with your thumb on the plunger. Ensure the bevel of the needle is pointed up. The bevel is the angled opening in the needle that allows the microchip to pass through the needle and into the equine. 7. When ready to implant, aim the tip of the needle into the midline of the upper lip. Note: the angle of the syringe should be slightly greater than the angle of the upper incisors. This is to ensure that you do not hit the underlying bone of the skull during implanting. The needle should easily enter the upper lip without any resistance. Be prepared for the equine to move or raise its head during this step. It can be normal to see a small amount of blood appear about 5% of the time, and that this will resolve quickly on its own. 8. Sink the needle into the upper lip to its entire length and depress the plunger until you hear or feel a click, indicating the microchip has been delivered. Remove the needle. 9. Swipe the implant area of the upper lip with your thumb to ensure the microchip stays at the top of the injection tract. 10. Dispose of sharps safely. 11. Scan the equine's nasal area with the reader to ensure the implant is working. 12. Record the name and microchip number sticker for each equine implanted. 13. 24 hours post-implantation, scan the equine again to ensure the implant is still there. Occasionally, a microchip can migrate back down the path of the needle. Swiping the area with your thumb immediately after injection will reduce this risk, and scanning the equine after 24 hours will also ensure that the microchip has remained in the equine. Very rarely, less than 0.01, is a nasal microchip lost after 24 hours.
I'm Dr. Wayne Burwash, and I've got an equine practice in Calgary, Alberta, Canada, and I've been practicing for almost 50 years. I've dealt with, of course, all kinds of horses, and specifically when we talk about permanent ID identification in horses, I've dealt for years with the tattoos that are often so illegible and hard to read, and horses that you can't restrain to read. And so I'm number one sold on the microchipping as a very permanent, very specific identification. And part of that, I do a lot of FEI work, International Equestrian Federation work, and I've been the veterinary delegate for Spruce Meadows for years, and of course have been reading microchips in all these world-class jumping horses for years. And what I've found with the nuchal implants, it's often hard to find these chips. They're anywhere from the pole down to the wither, and sometimes almost down to the jugular vein, and sometimes these horses just have two chips, even we can't even find one. So I've dealt with the nuchal implants for years, and they're difficult to find and to read, and very difficult to put in. Most horses need sedation, often using a local anesthetic under the skin so that you can implant them because it's a sensitive area. These nasal implants are a huge step forward in the way to go. I've been involved in doing babies that are barely halter broke, kind of half-wild yearlings and quiet show horses, and you can virtually do them all just with no sedation, no local anesthetic. The odd one you have to twitch, but that seems rare, and so they're so easy to implant. And the other big advantage I see in the long run is the reading of it. The horses naturally like to sniff things, and so you can just hold the reader out and they'll sniff at it, and you've got the chip number instantly, whereas it seems like so many horses are apprehensive about having their neck scanned, and they're jumping around. And you know, you can walk out in a pasture even with yearlings and 2-year-olds and just hold the wand or your chip reader out, and they'll come up and sniff it, and you've got a permanent, very specific identification. So I think there's so many pluses to it, both on the implant side and on the reading side. And the science, the experiments that they've done, the trials they've done with these show no migration at all. And so they're all very specifically in one place and very easy to read. So I don't want to oversell the technique because I know it's new, but in my experience it's a huge step forward, and I'd highly recommend it for the breed associations to adopt this position of doing the implant.
If you need more information, contact the Canadian Thoroughbred Horse Society. Alberta Division 403-229-3609. CTHS Web at ctsalta.com. National Division 416-675-1370. Info at cthsnational.com.